Cancer, Conquering the Enemy Within on ABC 27 is presented by Penn State Milton S. Hershey Medical Center.
Welcome back. Amy Stitzel of Lancaster County is here to share her story with us. Amy, thanks so much for being with us tonight. Now, you found out you had leukemia when you were 17 weeks pregnant.
Yes,
your reaction?
I was shocked. I was devastated. I was scared. But strangely enough, I had peace within that. I thought it would be okay.
Tell me, what was the next step?
The next step was that I went inpatient for 3 weeks at Winston-Salem in North Carolina. I was there, like I said, for 3 weeks until I was stable enough to travel back to North Carolina. And I began treatment at Hershey Medical Center, and I continued treatment for about 2.5 years.
So you had both chemotherapy and radiation?
Yes, yes. I had also spinal injections.
And what was the effect as far as on your daughter since you were pregnant?
My daughter's 5 years old. She's in kindergarten. She's happy and healthy, and there are no concerns at this point.
And how are you doing?
I'm doing fine. I am cancer-free, have been for nearly 7 years, and there are no lasting effects as well.
And tell me about your unexpected surprise.
Well, we were told we would be unable to have any more children, that there was a good chance we may not have any more children. So my husband and I decided to try to see what would happen last April of '07. So in July of '07, we found out we were pregnant, and in on August 13th, 2007, we found out we were carrying triplets. Naturally conceived, no medication involved, which was a blessing. We were very scared, but also a blessing.
Okay. Thanks so much, Amy, for sharing your story with us, and have a great time with your adorable children.
Thanks.
And Chuck, we will send it back to you in the studio.
Thank you, Deborah. That's an amazing story when you hear what happened there on both occasions. But we're joined now by Dr. David Claxton, Amy's doctor. The first thing I'd have to ask, how was she diagnosed with this cancer? I mean, at what point did that appear?
Well, Chuck, she was about 4.5 months pregnant, and she felt unwell. She had some cough and sinus symptoms and fever, and saw a doctor who did some blood work, and that was abnormal, and that led to her having a bone marrow examination. And so the bone marrow was examined by a team of specialists with lots of high-tech approaches, including some techniques that allowed us to demonstrate that this was acute lymphoblastic leukemia. That is what you see on the screen here, an example of her kind of leukemia. And I think here we see a more normal appearing bone marrow. So
you talked earlier about infusion chemotherapy. What is that for someone that's never been through that?
Her leukemia is everywhere in her body. So this was not something that could be surgically removed or treated with local radiation. It required chemotherapy delivered everywhere. And so she had a series of infusions of a number of different drugs, 6 or 8 different chemotherapy agents, and that was extended through her pregnancy. She was then able to deliver a healthy infant, and I should also mention that in addition to chemotherapy given intravenously, it was administered in her spinal fluid via spinal taps, because we needed to do that to prevent relapse of her leukemia in her brain.
Is it rare for a patient to receive chemotherapy while they're pregnant?
It's rare, but leukemia happens in young women and young men of childbearing age, and from time to time one of them is pregnant and we have to deal with it.
What about the child? That's the thing I first think of. What's the risk for the child?
And the answer is, in this case and in many others, the children can be delivered very healthy as long as the chemotherapy can be delayed until after the first third or pregnancy, when organs are formed. After that, the chemotherapy is tolerable, and she has a very healthy little girl.
Very hopeful. Thank you, doctor, for joining us. And when we come back, a Dauphin County man, he went into his doctor for a routine checkup. That checkup saved his life. The story's up next.